Introduce our morning session. Today we're going to be talking about the growing opioid epidemic and the federal response, as well as what the National Safety Council has done to bring to light this issue and help its victims. We have two esteemed speakers this morning. First, the Surgeon General Jerome M. Adams. Dr. Adams oversees the operations of the U.S. Public Health Service Commissioned Corps, which has approximately 6,500 uniformed health officers who serve in nearly 600 locations around the world, promoting and protecting and advancing health and safety of our nation and our world. Prior to being sworn in 2017, he was the Indiana State Health Commissioner. So welcome. Thank you for being here. Second, you will hear from Kathy Lane. Kathy Lane is the Senior Director of the National Safety Council, whose mission is to eliminate preventable harm and death. It is my pleasure to welcome them both. Thank you for coming here this morning, and we're going to start with Dr. Adams.
Well, good morning, everyone. How are you? Thank you all so much for being here today, first of all, for showing up yourselves. And thank you to the Chicago Executives Club for really changing some things around and giving me the opportunity to speak with all of you today. I also want to give a big shout out to Doug O'Brien. Doug, we're over there hiding in the back of the room. If you don't know Doug, you should know Doug. He's the regional director for the Chicago area and really is HHS's representative for all things health in this area. He was generous enough to give me his speaking spot so that I'd have the opportunity to address a critical group of leaders, and so I'm just really appreciative. He's also my chauffeur today. Thanks for that too, Doug. As Surgeon General, it's my job to communicate the science around health to the American people, particularly regarding the health crises that are most impacting them. And we're here today to talk about a health crisis like none other that we've experienced in the last several decades, the opioid crisis. I've dedicated a significant amount of my time as Surgeon General to raising awareness about what each and every American can do to play their part in addressing misuse and overdose. And I will talk about the postcard a little bit later, but the bottom says this presentation is for official use only and not for public release. That's not our postcard material. You can take this, you can tweet this out, you can send it out through your social media. You can pull it off of surgeongeneral.gov right now, and we want you all to do that. You know, as your Surgeon General, I've tried to take this complex and ever-expanding epidemic and distill it down into ideas and actions that allow everyone to understand how they can be part of the solution. And after traveling all over the country to talk about the causes of the epidemic, the fact is it really boils down to two things from my point of view that I hear over and over and over again: stigma and ignorance. So while my office and the administration really could talk all day, and we have had full-day conferences about how we're responding, at its essence, we're really working to fight stigma and to help educate the country about what addiction is and how they can respond to the epidemic. As the statistics demonstrate, it's likely that many, if not most of you here today, have been touched by the opioid crisis. And like you, for me, this crisis isn't just pressing, it's very, very personal. Opioid addiction has touched my immediate family. My own brother, Philip, is currently serving a 10-year prison sentence just down the road from my office in Washington, D.C., for crimes he committed to support his addiction. My brother, Philip, suffered from untreated mental illness and unfortunately turned to tobacco, alcohol, marijuana, and ultimately pills to self-medicate, and he committed crimes to support his habit. I share my personal struggle, painful as it is, not to evoke pity, but rather to illustrate that addiction can happen to anyone in any family, even the brother in the family of the United States Surgeon General, and that we all have to work together to put forward a comprehensive response. Because if I couldn't protect my brother alone, none of us can do it alone. I like to believe my personal connection to the opioid epidemic has made me a more understanding civil servant. I think that because my family, like so many American families, and perhaps some of yours have been touched by the opioid crisis, I'm able to empathize with their struggles. And I think that by sharing my story, I'm giving others the courage to share theirs, and that together we're fighting that stigma that I know is one of the biggest killers out there. Unless individuals feel comfortable talking about and seeking help for their addiction, we won't be able to ever reach those who are most in need of that help. It's important that we all recognize, and that's part of what this postcard is about, this digital postcard, that addiction is a chronic disease, but that effective treatment is available and that people recover each and every day. Now, I said stigma in education. So on the educational front, I want you to know that my office is focusing on prevention and on naloxone. We must prevent addiction before it starts. We've got to put out the fire, but we've also got to stop more fires from starting. And that's why I'm working with healthcare professionals. I've been here at the Prentice Hospital before talking to folks in the anesthesia unit, but talking about safe prescribing practices. We're also helping patients and prescribers understand the benefits of alternatives to opioids, and this is important for all of you all in this room, and understand how to safely store and dispose of their prescription opioids, because 4 out of 5 heroin users got started with a prescription opioid. We like to think of drug dealers as these bad people in back alleys. You know who the first drug dealers are for 4 out of 5 people in the United States? Their grandma, their aunt, their uncle, they're the neighbor. They're each and every one of you, they're us. Anyone who's left unused opioids in their medicine cabinets, those opioids are massively being diverted and starting people down a pathway to addiction. I've also been working with the Truth Initiative and the Ad Council on those PSAs you, or more likely your children, may have seen about the dangers of opioid addiction and misuse. And in order to get the word out about naloxone, I released the first Surgeon General's advisory in 13 years. Shocking statistic, a person dies every 11 minutes from an opioid overdose, and most of those people are not dying in a medical setting, they're dying at home. They're dying in public. I was at the Amtrak station just yesterday in Philadelphia, and they told me that they're averaging about an overdose a week in their public bathrooms. My advisory calls for those who are at risk for having or encountering an overdose to carry and know how to use naloxone. Because any one of you can save a life, and we are not going to dig ourselves out of this hole if we just expect first responders and police officers to do it all. We need every single one of us, if we walk into a bathroom down the street and find someone overdosing, to at least be able to recognize the signs and symptoms, and ideally to have naloxone on you. I carry it with me everywhere I go. I've also been on the other side of the opioid epidemic, approaching it from the lens of a public health civil servant, in addition to dealing with it personally. As State Health Commissioner of Indiana, I oversaw the response to the largest outbreak of HIV in the history of the United States related to injection drug use. And some of you all may have heard a little bit about that. It's not a moment that I'm proud we had, but I am proud of the response to that crisis that is still ongoing. In order to stem the tide of the opioid epidemic that was washing over a little town in southern Indiana, I had to form strategic partnerships with local stakeholders like you all, to truly make a difference. And it's interesting, people always ask me, how did you solve this crisis? How did you deal with the epidemic? Who did you call? Was it the CDC? Was it NIH? Was it Indiana University? And the truth is, yes, I worked with all those folks, but the folks who I called first, who were most critical, were the local sheriff's department, the local faith-based leaders, and the local business community. Why? Because I knew what we needed to do from a public health and a medical point of view, but I needed the cooperation, the input, the buy-in from community influencers and leaders, such as all of you all, in order to get them to accept these practices and to put them into effect in a community. And while the answer may seem shocking at first, folks are starting to realize that we can't fix the opioid epidemic from our silos, particularly from our medical and public health silos. We must partner together in order to have a comprehensive and an effective response that helps individuals get back on their feet, that prevents addiction, and that sets up folks for long-term recovery. And that's an important side of it too, long-term recovery. I was talking to someone who was suffering from addiction in Philadelphia, and what was really striking to me is he said, treatment's actually easy. You go in, you're in a contained environment, everything's controlled, they tell you when to get up, they tell you when to take your medication-assisted treatment, they tell you when to go to therapy. He said the hard part was after treatment was over, and they returned me back to the community and to the same stressors, the same environment that I was in before. We need to focus not just on treatment, but on recovery if we're gonna successfully put people back on the pathway to becoming successful members of our communities. So I want to talk about what companies can do, particularly to this group, and let's start off within the workplace. Companies have to realize that there are concrete actions that they can take, that each of you all can take to make a difference in your workplace and in larger communities to prevent accidental opioid overdoses and to prevent people from going down the pathway of addiction in the first place. Number one, I encourage you to make sure that naloxone, the opioid overdose reversal drug, is available in your first aid kits in your offices. You never know who might be struggling and who could need to be revived due to an accidental overdose. I was in Fort Wayne, Indiana, just down the street from you all last year, and what was shocking to me is we were looking at their statistics of who'd overdosed in the last year, and 70% of those who had overdosed had a job. So it's not that old picture of addiction that we think of. These are people who are going to work each and every day. These are people who may be overdosing on their lunch break, who may be overdosing in your bathrooms. And the fact is, we need to have naloxone available. Number two, more than half of heroin users become addicted to prescription opioids before making the transition to illegal drugs. As I mentioned, 4 out of 5 injection drug users got started with a prescription opioid, either theirs or someone else's. So as executives, I encourage you to push for insurance packages that promote safer opioid prescribing and that cover opioid alternative pain management strategies to curb the unnecessary overprescription of opioids. So remember earlier when I said the first drug dealer is grandma, the first drug dealer is aunt or uncle? Well, unfortunately, the first payer for those opioids is often you all. 3 ways that the majority of people in this country get prescription opioids: Medicare, Medicaid, and their employer insurance programs. We have to make sure we're paying for the solution and not the problem. And speaking of that, I'd ask you to make sure your company policies cover mental health and addiction treatment services in compliance with the Mental Health Parity Act. We know treatment works and that recovery is possible, but that only happens when individuals have access to the best practice interventions. If your plan doesn't pay for folks to get mental health treatment, then people like my brother go on and continue to suffer from anxiety and depression, unrecognized, untreated, because it's not covered. If folks don't feel like they can get recovery paid for, then they're not going to come forward and admit that they have a problem. So finally, I'd say take a look at companies like Belden in Richmond, Indiana. Anyone heard about Belden? The second lady and I visited there about 3 weeks ago. An amazing, amazing place. I encourage you to look it up if you haven't. If a job applicant there fails a drug test, they connect them to treatment and hold a job for them. Why? Well, Belden is in this small town. They've been there for over 80 years, and they're being hit hard by the opioid epidemic like many other folks are. They had over 300 people who submitted an application, went through the first interview, and then failed the drug test to hire for 40 or 50 positions that they needed. They realized we can't do this anymore. It just doesn't make financial sense. It is an inefficient use of our time and our resources. And so now they test people up front. And again, if they test positive or if they identify themselves as having substance use disorder, they get them into treatment that's paid for. And then if they're successful in treatment, they will hold a job for them. And they found that the people who make it through this program are some of their most loyal employees. And another thing that I heard from an individual when I was in Philadelphia, he said, the biggest predictor of success in treatment and recovery is having something to recover for. I think of my brother who's sitting in prison right now. He's going to come out, and he's not going to be able to get a job. He's not going to be able to find housing. He's not going to be able to do anything but go back into the same habits that in the same environment that he had before, unless we can help him see that there is an alternative out there. And again, it starts with helping folks understand that they can find meaningful employment. So I'll ask you, what is your company doing to promote the status quo, which isn't working, versus to fight stigma and to promote recovery and workforce participation? I want to finish by talking about what you can do in the community. Anyone remember this guy named C. Everett Koop? One of my predecessors. In the late 1980s, he used his platform to send a pamphlet called Understanding AIDS to every household in America. Anyone in this room remember that? There are some folks who may have gotten that. Sent it to every household in America in the hopes of educating every family, every household about AIDS and provide the latest prevention steps and ways individuals could get involved to stop AIDS. Because 30 years ago, stigma and ignorance were killing thousands of people again. This opioid crisis calls for the same approach. So I put out my 21st century advisory to educate Americans about the opioid crisis. I want every individual across the country to receive this postcard. It provides the public with tangible actions they can take to raise awareness, prevent addiction, and prevent overdose deaths. You ever heard that phrase, how do you eat an elephant? One bite at a time. Well, I want you all to remember that, because the problem with the opioid epidemic is it is a giant elephant that is sitting right in the front of each and every one of us. And we look at that elephant and we're like, there's no way I can eat that thing. Why even try? And then we start pointing fingers and say, it's your job to eat the elephant. No, it's your job to eat the elephant. I surely can't do it. Well, I'll tell you, not only if we take it one bite at a time, but if we divvy up the work, all of us in this room could eat an elephant in a very short amount of time. But any of us in this room couldn't eat an elephant on our own, no matter how much time you gave us. It's really important that we show everyone how they can take their bite of the elephant, and this digital postcard is an important step. I encourage you to print it out and email it to your listservs to educate your employees and their families about the steps they can take to combat the opioid crisis. And for folks who are interested in a bit more in-depth info about how and where to seek treatment and what best practices look like, go to surgeongeneral.gov and take a look at my Spotlight on Opioids, which I just released. The Spotlight contains step-by-step information about how to spot the signs of addiction and overdose, what to look for in a treatment facility, and best practices and standards of care. It really distills it down into about a 45-minute to an hour read, all the science behind addiction, treatment, and recovery. And then I want to finish with something that's not directly opioid related. I want to talk to you about our Community Health and Economic Prosperity Initiative, which I hope you all will invite me back to talk more about later. Healthcare costs are 1/5 of our national GDP, a drain on our ability to invest in infrastructure, education, and the economy. And as many of you all know, the #2 cost behind salary for most middle and large-sized companies. It's a big, big problem that we have. We intuitively and literally know that healthier communities have more prosperous citizens and companies, and that communities that are unhealthy are really suffering in terms of prosperity. And the opioid epidemic, again, has really illustrated this point in a major way. Well, my office is working on a report that compiles the evidence linking community health risk factors and metrics and business prosperity indicators like workforce participation, like absenteeism and productivity, like workforce accidents, and you're going to talk about that perhaps in a little bit. We're also hoping as part of this report to put together a toolkit of best practices garnered from businesses and communities, like many of yours, that are partnering in innovative ways to lift up not just employee health, because employee health is important, but also community health. Because we focus on health care, but health care is only 15 to 20% of overall health. So eventually you're going to top out if you're just focusing on health care. And we know that most of the covered lives in your employee programs aren't the actual employees who come to work. They're the spouses, they're the children. They're driving up the cost too, so you're not going to change your health care cost for your company if you only focus on what happens while they're on the job site. And we can have the best worksite wellness program in the world and I think you all should look to optimize worksite wellness programs. But if we do everything right from 8 a.m. to 5 p.m., but we send them home to an environment from 5 p.m. to 8 a.m. the next morning that is unhealthy, it doesn't have access to fresh fruits and vegetables, where people are smoking because there's not clean air laws, where they can't exercise because they're not complete streets or it's not safe. And it's going to undo everything that you all accomplished while they were on site during their worksite wellness programs. So I'd like to leave you with 4 quick challenges. First, join me in advocating for wider understanding and use of naloxone. Every one of you has the opportunity to save a life. Second, please distribute online and in print my Surgeon General postcard. By increasing awareness of the 5 easy things that anyone can do to fight the opioid crisis, you're promoting a healthier and safer community, both for your companies and the larger communities in which you reside. Third, go for extra credit. Take 45 minutes to read my spotlight on opioids. Can you spare 45 minutes to save a life? It takes less than an hour to educate yourself about best practices and the recent data around the opioid crisis. Every one of you has a role to play, and you should consider taking the simple steps that apply to your life in order to play your part to address the opioid crisis. You know, I've said this often, there's nothing more powerful than one of you business execs out there armed with the correct information. There's nothing more dangerous from a health point of view than one of you all out there armed with falsehoods and without the facts. So please become informed about the opioid epidemic. Take 45 minutes, read that spotlight on opioids. And fourth, while you're at surgeongeneral.gov downloading the postcard and the spotlight, because I know you will, look at my video about our CHEP initiative, our Community Health and Economic Prosperity Initiative, and respond to our RFI with best practices, challenges, and anything that you want to see in our report. My goal is for this to be unlike any Surgeon General's report ever written before. The target audience is not health professionals. It's business professionals like all of you. And we need your help to make sure that we don't miss the mark. So thank you all again for getting up so early to start your day with me. And thank you for putting up with me. You can probably tell I've got a cold coming on, but I've got 14, 12, and 8-year-olds at home. And there are several folks in my office who have little ones who are passing the cold around too. So wash your hands. It's flu season. Make sure you get your flu shot. I know we weren't supposed to be talking about this either, but I was looking at an article just this morning while I was in bed. Companies that, that have the highest flu participation rates, flu shot participation rates, are those who make it as easy as possible for folks to get their flu shot. Dolly was just telling me her sister works at the White House, and they actually do desk calls. The doctor walks around to people's desks and gives them flu shots. But at least consider, you know, this year or next year, if it's too late to put it into action for you this year, about providing flu shots on site for your individuals. The average county across America loses $1 to $2 million in productivity each and every year because of the flu. 80,000 people died from the flu last year, and that's not counting all the people who got the flu and who weren't able to come to work, or who were less productive while they were at work, or who came to work and got other people at work sick. So again, please, please, please do all you can, and I wasn't supposed to talk about that, but to make sure folks get the flu shot. My stuffed up nose made me think about it. So thank you so much for the opportunity to be here. Thank you for the honor of serving as your United States Surgeon General. And if we have some time at the end, then I'm happy to take a few questions, but I'm really looking forward to your conversation. I was more excited to come here and hear from you than anything else. So thank you so much.
Alt-tab. All right, I did it. Thanks to the Executive Club for having me here today. I couldn't be more honored to share the stage with Dr. Adams, and just as proud to present the work of the National Safety Council together with Energy BBDO. Thanks to all of you for showing interest in this topic. As Dr. Adams said, it really is a complex issue that takes everyone, and together we'll be able to eat that elephant together. So first, I just wanted to start by sharing a little bit about the National Safety Council, because not everybody is familiar with who we are. We were founded over 100 years ago, right here in Chicago in 1914. We are a membership-based organization. We have over 51,000 members, which covers over 8 million employees. Our mission is to end preventable deaths on the road, at work, and in homes and communities. We follow the data. Where are people dying and getting injured? And that's where we work. We looked at the opioid issue about 10 years ago, and our researchers are like, uh-oh, this is getting to be a real issue. So we started working on it about 10 years ago. And as such, we have kind of a three-pronged strategy: prescriber education, changing policy, and raising awareness among the public. So when we set out with Energy BBDO to create a public education campaign, we really had three objectives. We wanted to educate the public, we wanted to eliminate those excess pills in circulation, and we wanted to empower people to have informed discussions with their doctors. So we met with the great team at Energy BBDO, and we said, how do we get the public's attention? There's so many scary things out there. The media is, maybe sometimes not always pointing us in the right direction of what's really likely going to harm us. And so together with BBDO, they came up with a provocative idea that really caught the public's attention, and here's a picture of it. This is a wall of 22,000 pills. That is how many people died in 2015. On each of those pills is carved the face of someone who overdosed. Today, 2 years later, does anyone want to guess how many people died in 2017 from opioids? 49,000 people. In 2 years, that number has doubled. As Dr. Adams said, today, one person dies every 11 minutes. When we built this, it was one in 24 minutes. So alongside the wall, we had a carving machine to simulate that 24 minutes. So every 24 minutes, a pill was carved on site. So I am going to show a little video to just kind of describe the campaign. Oh. Which one do I press to play? Sorry. Jerem is my tech support. There we go.
Take a look at these pills. Each one has a face carved into it.
A haunting, yet beautiful and powerful new memorial, a traveling tribute, if you will, to families hard hit by a national epidemic.
Okay, so there's something that I would like to show you. A room next door here that I would kind of remind you of what you had in your hands.
Okay.
Okay?
Let's go.
The National Safety Council created a memorial. It features 22,000 carved medicine pills, each of them bearing the face of someone who fell victim to the crisis.
22,000 pills. A new pill will be etched on site every 24 minutes.
That's how often a person in the United States dies from an overdose of prescribed painkillers.
This is somebody's daughter, this is somebody's son, this is somebody's husband, this is somebody's brother.
I get overwhelmed every time I see the wall because I was really close to being on this wall myself.
I never actually thought about my addiction too much. Now it's really making me see things more clear.
And so the biggest risk to them may be sitting in their medicine cabinet and they're not acknowledging it.
The Warn Me label that they can affix to their insurance card that says, hey, I want to talk about drugs that are prescribed to me.
So I have to quickly mention, when we were in our nation's capital, We were so fortunate to have the U.S. Surgeon General come visit the memorial, and if I had more time, I would have put the pictures of you visiting the memorial because I have some great pictures, but thank you for your support of the memorial. So the first objective, as I said, was to catch the public's attention, which the wall did and those great videos did. Our second objective was to get those excess pills out of circulation. According to SAMHSA, half of people who misuse opioids report getting them from you and I, friends and family. According to a National Safety Council survey, a third of people who have been prescribed an opioid keep those leftover pills for later. I can share a personal story. When my mother went through years of health issues, she literally had a big shopping bag of unused pills or leftover pills in her bedroom. And I'm not talking about one of those cute little shopping bags. I'm talking about I went to Nordstrom's and went on a major shopping spree, shopping bag. And they were just sitting in her room. Why did she keep them? I'm not sure. It could be that she bought them and didn't want to waste them by throwing them away. It could be that she may need them later and she's already bought them and doesn't want to pay for another prescription. Or it could be she just didn't know how to get rid of them. So part of what we wanted to do was get those out of circulation. So we partnered with a company called Stericycle, and they produce these great seal and send envelopes. Very easy to use. You put leftover pills in here. They're DEA approved, postage page, goes back to Stericycle incinerator, and you put them in the mailbox. Simple as that. We wanted to give people that go through the memorial who say, ooh, I have leftover pills, we wanted to give them something to do. So I brought a few extra in case anyone would like one. The holidays are around the corner. Thanksgiving, Christmas, we have a lot of people coming in and out of our houses. Get them out of your medicine cabinet. I have a few. If you need more, I'd be happy to get them to you. So the second sorry, once again, it's.
I think we saved the wrong one.
Sorry about that.
It's okay. It's not your fault. You just click there.
I'm going to have one more video. So the third objective was to empower people to have informed discussions with their physician about opioids. So we created, again, with the creative minds at Energy BBDO, and they're at your table, so please take one. These are Warn Me labels. This is to put on your insurance card. This is to remind not only yourself, but your prescriber, I want to be warned if you give me an opioid. There are so many brand names of opioids. According to an NSC survey, a third of people taking opioids didn't even know they were taking opioids. It's very hard to keep informed of all the different brand names. So please take the card, you can even take out your insurance card right now. I can tell you another small personal story. I recently changed dentists, and so when I went there, of course, my label is right there on the card. It reminded me, it prompted me to have that conversation, and I live with this stuff every day. I was like, oh yes, please make a note in my file that I want to be warned if you're going to prescribe me an opioids, because dentists prescribe a lot of opioids. Again, giving people something to take action. So as you saw in the video, we brought the memorial on the road. We launched here in Chicago. Can you believe, Denise, it was a year ago? Last November here in Chicago. And then we wanted to take it to other places to spread the word. So after Chicago, we went on the University of Pittsburgh campus. We went to the RX and Heroin Summit in Atlanta, Georgia. Together with the White House and the National Park Service, we brought it to our nation's capital. We then went to Buffalo, New York. We just returned from the University of Arkansas, and this weekend we are headed to Houston, Texas. The National Safety Council Congress and Expo is the world's largest safety conference with other safety professionals, about 15,000. So we're really excited to bring this to the business leaders and safety professionals so they can make impact in their workplaces. So in each stop where we went, we had a systematic, tried and true marketing campaign, marketing effort that really worked in each city. When we went to each city, we started off by having a press conference. At each press conference, we unveiled the memorial with a local dignitary. Sometimes it was the local mayor. Sometimes it was a lieutenant general, lieutenant governor. Sometimes it was an attorney general. Sometimes it was a cabinet secretary. But we also had a local family that was impacted by opioids because we really wanted to give a local face to the issue. It really drove national and local coverage and drove visitors to the site. You know, I was in every stop and I would ask people as they're coming in, how did you hear about it? And 7 times out of 10 it was, I saw it on the news. Yeah, I'm in the business and I was surprised so many people still watch the news and actually do what they see on the news. So this really helped drive visitors to the memorial. We also had out-of-home advertising right before we went to the city and while we were there in and around the memorial to drive traffic. We also wanted a message to people that were most likely going to be prescribed an opioid. So we created a short educational video and we had them in doctors' offices, again, at the time we were in the city, to drive awareness. So social media, of course, drove a lot of our awareness and our traffic to the memorial. We were very fortunate to have a lot of influencers that really cared about the issue, want to amplify our message. So we had NBA star Rex Chapman, who's had issues with opioids, tweet about it early on. We had comedian Russell Brand. We had the president and the first lady. And of course, yours truly, the Surgeon General, when he visited, thank you for helping amplify our message, tweeted about his visit. So we wanted to find out, of course, what kind of impact were we making everywhere we went. So after we visited a city, we emailed those people that visited the memorial, and we were so pleased with the results. These are the collective results of all the cities we've been to. 85% said that visiting was worth their time. 86% are willing to talk to their doctor about non-opioid alternatives. 85% are very comfortable talking to friends and family about risks. 73% have already used or are planning to use the Warn Me label, and 27% plan to use the pill return envelope. These were just really heartening results because it's an awareness-raising campaign, which is extremely important, but this was also connecting to changing people's behaviors and their actions to keep themselves and their families safe. So I'm going to add to what Dr. Adams shared about effect on employers, because all of you really do, you're in such a position to really make a difference in the lives of your employees. The National Safety Council conducted a survey among 500 HR professionals. We wanted to know about their experiences and their perceptions of opioids in their workplaces. Startlingly, but maybe not so, 70%, more than 70% said, yes, my workplace has been impacted by opioids. But only 20% feel extremely prepared to deal with the issue. 3/4 of HR professionals were not offering any training on how to identify signs of drug misuse. Over 80% did not have a comprehensive drug policy. The good news is, like Belden in Indiana, 70% of employers said, I support wanting to get employees in treatment and hold their job and get them back to work rather than terminate employment immediately. And when you're at the bottom, when you're at that level of addiction where you've maybe lost your friends and family, you might still be holding on to your livelihood, you have such potential to get them into treatment with the hopes that they're going to maintain their livelihood. So how did employers say they felt the effects of opioids? 40% said that they saw employees missing work because of their opioid use. A third tested positive for drugs. Another 30% saw a decrease in job performance. 30% said they saw one of their employees affected because of a family member. We all know we are part of families. So when our families are having issues, we're missing work, we're worried at work, we're calling the doctor. It's affecting workplaces. As Dr. Adams said, all of us are dealing with opioids in the workplace, whether we realize it or not. The leading cause of preventable death for middle-aged people are drug overdoses. And where are people that are middle-aged? They are in the workforce, most likely. They're you and I, and they're people we work with. So what can you do as an employer? Here are some additional ideas, and naloxone is missing. Thank you for pointing that out. One thing you can do is first figure out, especially if you need some talking points to other senior and leaders in your organization, well, what are drugs costing me or my organization because of drug misuse? The National Safety Council, together with Harvard, developed a cost calculator so you could figure out how is it affecting your bottom line. So you say what industry you're in, you say how many employees you have, what state you're in, and it'll calculate how much your organization is likely costing. And I guarantee you it's going to surprise you. So if you go to nsc.org, Drugs at Work, you can access that calculator. We also developed a toolkit. The toolkit has, I can't say everything you'll ever need, but it does have a lot of resources to educate your employees about the risks, but also what you can do. So it has a sample drug policy, for example. Expanding drug testing panels to include opioids, training supervisors, employees on how to spot signs of misuse, leveraging your employee assistance programs. Check into what they offer at your organizations. They likely offer assessment, pre-counseling, long-term counseling, would likely help your employees get into treatment or find treatment. And of course, order Warn Me labels. We want to get these in as many people's hands as possible. We still offer them free of charge because of our very generous donors. Order them for your employees at nsc.org. Take action. They're free of charge, as I mentioned. Soon, we're all going to be getting our new insurance cards in the mail after the first of the year. If you order them now, you'll have them in time for when those new insurance cards come. I want to close by sharing one more video. This is a video from the campaign. This is Rigo, who was a healthcare professional, and he became addicted while working in a healthcare setting. And I remember him telling me, he said, being a healthcare professional addicted to working in a hospital was like an alcoholic working in a bar.
I thought it was the most selfish thing that anybody could do, and then it happened to me. I was 100% convinced that it was willpower, it was poor decisions, it was a moral defect. If you look a certain way, you won't get addicted. If you're smart, you won't get addicted. If you have a good family, you surely won't get addicted. My life was really good. Mom, dad, picket fence. I have really, really favorable, enjoyable memories growing up. Addiction doesn't look like you're incapacitated and you can't do anything. Addiction doesn't look like you're living homeless on the streets. Addiction is often very functional. Addiction hides in your family. It hides at your profession. There's another side to the story, a side that nobody talks about, a side that is affecting everybody. I get overwhelmed every time I see the wall because I was really close to being on this wall myself.
Rigo's story has a happy ending. Him and his beautiful wife, Claudia, and their 3 kids, they live in Indiana. They opened a treatment facility to help other healthcare professionals fight their addiction. The truth is the vast majority of people that have a substance abuse disorder do go on to live rewarding lives, and Rigo is just one inspiring story. Thank you very much.
With me and we'll take questions together? Yeah. Come with me and take questions together. That way she'll take all the hard ones.
Hi, thank you both. I was wondering, since we have such a huge amount of basically a crisis, how much do we really know now about addiction and the root causes?
Well, that's a great question. And again, I would implore all of you to read the Spotlight on Opioids. We know a lot about addiction. We know that addiction is a brain disease. We know, and what's amazing is it was life-changing to me, even as a physician, when I first sat through one of Nora Volkov's lectures. I don't know if you all know her. She's at NIH, and she showed the brain scans of folks who suffer from addiction compared to a regular person. And seeing that really just drove home to me that your brain does change, but then she showed folks in recovery, and your brain can change back. So we know a lot about the science of addiction. We know a lot about the science of treatment. Medication-assisted treatment is the gold standard that's available out there, but there's still far too much stigma against medication-assisted treatment. People think you're enabling. I tell folks all you're doing is enabling recovery if you give people medication-assisted treatment. We know a lot about what type of recovery supports people need, and there are lots of best practices out there. Unfortunately, the one thing that we don't know yet is who is going to be at risk for becoming addicted to opioids. It's why we want to warn everyone about the dangers of prescription opioids. And it's not to say that it's inappropriate for everyone, but folks need to have that conversation. They need to force that conversation with their providers. Because even from a provider point of view, we can't look at you and tell you, well, yes, you're going to be my brother, and having one pill is going to be like a light switch going off, whereas you're going to be different. So that's what we don't know, and it's why we have to be so cautious. I don't know if you have further comments.
No, the only thing I would say is you're the doctor, but just knowing if you already have any risk factors is just knowledge to share with your prescriber. Are you a smoker? Are you a regular drinker? Do you have any other addictive behaviors? It's just good to share those. We all want to hide those from our doctor, but those could perhaps be an indication. May or may not, but it's just good to share those.
Do you have a family history? It's another strong predictor of whether or not you have risk factors for substance misuse disorder. But stigma prevents us from talking about any of those things ourselves, because heaven forbid we label ourselves as being potentially at risk. We have to overcome that stigma. We've got to share our stories. We've got to look at this as a disease.
I don't know. I'm not very good with microphones. Is there or will there be training for lay individuals who are not opiate users in the administration of Narcan? Because I'm sure that many opiate users do not have Narcan, and oftentimes it's the family members that come into the house and see somebody who's either close to losing consciousness, et cetera.
You don't have one on you, do you? Okay. Well, and mine is actually in my briefcase downstairs in the car. But yes, most states, every state has naloxone available to third parties via a standing order or some sort of way that you can go. You can go into any pharmacy in the country and ask for naloxone and get it. Number one. Number two, almost all the states have is that some sort of training that's available for individuals. You can go to don'tdie.org, and there is training available for naloxone. Oh, we actually have one right here. I'm going to give you naloxone training really quickly. In 2 minutes, it'll show you how easy it is. Number one, you want to recognize the signs and symptoms of an opioid overdose. The most frequent ones are disordered breathing or not breathing. So if you find someone who's not breathing or just really having difficulty breathing, that's one of the signs and symptoms. Another one is loss of consciousness. They're just not acting right. They're looking like they're under the influence of something. And so those are the two biggest ones. We also talk about pinpoint pupils. There are other signs and symptoms you can look at on surgeongeneral.gov. But the two big ones are you breathing and are you awake or alert? Step two, try to stimulate the person. So a sternal rub is a great way to do it, shaking them really vigorously, because the truth is you want to make sure it's just not a person who's asleep. And if they don't respond, they may be having an opioid overdose. Step three is call 911. You want to make sure help comes, because even if you have naloxone, with fentanyl out there, folks may require multiple doses. So that first dose may be enough to keep them alive until the ambulance comes and brings the second dose, but it may not be enough to help them fully recover. Number two, if they are having an overdose, you want them to be connected to medical care for a follow-up. I was at the train station yesterday in Philadelphia, and the Amtrak police officers were telling me they had to give 4 doses of Narcan to an individual this last Saturday to resuscitate them because of the synthetic opioids and the fentanyl and carfentanil that's out there. So call 911. Then the next step is giving naloxone. There's 2 different versions. One is an injectable version that Evio makes, and it talks to you. It's like an EpiPen that we give to folks if they're having an allergic reaction. You pull it out of the box, and it tells you what to do. You put it on your thigh, you press, and it injects the naloxone into your thigh. This version here, you put it in your nostril, and you just push. And that's literally how easy it is to save a life. Recognize the signs and symptoms, stimulate, call 911, administer naloxone. So you all got your naloxone training. Go out to your pharmacy, go out to your local Walgreens, ask for naloxone, get naloxone through the standing order, teach some other folks. That's the way we're going to get the word out there. But great question. It's super easy, and you should be able to easily get naloxone when you pick up your naloxone from the pharmacy or online or from a friend.
The only thing I would add to that is what I found really helpful when I had my naloxone training was that if you suspect, there's no harm in getting naloxone. Yes. So I think some people get worried that, well, what if it's not? I don't want to make that mistake. There's really no harm in giving it, so you're better off doing it.
It's a very safe drug, but that's also why you want to call 911, because if it isn't an overdose, again, then that means they need help for something else that's going on, but you're not going to hurt them by giving them naloxone. I'm sorry, did you have a follow-up, ma'am?
No, but my follow-up is pays for the insurance subscription. I know you provide them
Most employer insurance actually covers naloxone, and as you mentioned, Medicaid, Medicare cover it if you have it. So most people who have insurance, when I say most, we actually checked, it was 97% who have insurance, naloxone is covered. Beyond that, this year is about $35 for one, or a 2-pack is $70 if you have to buy it. And then the federal government has put out literally hundreds of millions of dollars for communities to be able to purchase naloxone to then give away through health departments, through hospitals, etc. So I'm not going to tell you that it is free, but I will tell you that there's a lot of help out there for folks to be able to get it if they need it.
Just first of all, thank you both so much for doing this. Kathy, the postcard, Dr. Adams' postcard should go in the National Safety Council's kit. But my question was about that. Your C. Everett Koop and how he put the postcards in every American's mailbox. Yes. What's inhibiting you from doing that? Do you need funding for that, or how can we get you to be able to mail that to every American?
Thank you so much for that question. We explored trying to do what C. Everett Koop did. Number one, it's a whole lot more expensive to mail things nowadays, and it was going to cost us upwards of $100 million to mail those all across the country. And quite frankly, if I had $100 million, I'd rather spend it on naloxone, on treatment, on other things than sending out than postage. But number two, when we talk to folks, that's not how people get their information anymore. They get their information on Facebook. They get their information by email. They get their information digitally. So we had a much more effective means to push out that information. The problem is we don't have control. So that's why we need all of you all. I can push it out to the folks that I'm in touch with, but then we need you all to utilize your networks and continue to push it out through your networks so that we can get this postcard to the entire country. Sir?
Hi, John Davidoff Strategy. Also want to applaud both presentations, really helpful and informative. I was wondering, as business leaders, what else we can do in addition to minding our loved ones and employees and what can we do through affecting policy, maybe through our local public health department or state public health department, and what else is happening on the policy front?
Number one, show up for these conversations. When I was in Scott County, Indiana, it was the Chamber of Commerce showing up who helped convince local leaders that, hey, we need to go ahead and institute a syringe service program. Now, there are many different tools to bring the mayor to respond to the opioid epidemic, but you all going out there to Belt and standing up in the community and saying, we're going to connect people to treatment with medication-assisted treatment, can change the culture in a community in a way that the health official, even the Surgeon General of the United States can't. I would much rather have Bill Gates out there telling folks that they need to carry naloxone than me as Surgeon General. And it's just the way it is. You all are respected influencers. And I would tell you very specifically, some of you are big companies, some of you are small companies. If you don't have a point person working on opioids in your country, then let me ask you this. There was something causing a 20% decrease in productivity in whatever you're producing out there. Wouldn't you hire a person? Wouldn't you bring in consultants to address it? The opioid epidemic it's a symptom of a larger problem, and that problem is a lack of health and wellness in our communities. But number one, we've got to put out the fire. You've got something out there that, whether you realize it or not, is significantly affecting your bottom line, and you need to address it, and then we need to get upstream and deal with the upstream causes, the lack of health and wellness in our community, so that we're not continuing to play whack-a-mole. So get involved in those policy discussions. Far too many folks say, it's not my business to show up and when they're having a discussion about clean air laws. It's not my business to show up when they're talking about whether or not they're going to put a new sidewalk in. It's not my business to show up when they're talking about whether or not we're going to have a syringe service program or whether or not we're going to have a methadone treatment center in our community. It is your business, and it's affecting your bottom line. So we need employers to engage and to realize that there are actually lots of things they can do, and go to the National Safety Council website again and pass those along through your company, those steps that employers can take to lean in.
Thank you, Dr. Adams and Kathy. I'm afraid that's all the time we have for today. Thank you, everyone, for coming, and have a great rest of your day.
And we both love to, if we didn't get to your questions, Facebook us, tweet us. We love to engage. We want to make sure we're using your influence to get the word out. So thank you.